1. A nurse is caring for a patient with Clostridioides difficile C.diff infection. Which infection control measure is most appropriate? 1. Use of alcohol-based hand sanitizer. 2. Wearing an N95 respirator mask. 3. Performing hand hygiene with soap and water. 4. Using droplet precautions. Answer: 3. Performing hand hygiene with soap and water. 2. Which patient should the nurse see first based on infection control priorities? 1. A patient with tuberculosis on airborne precautions. 2. A post-surgical patient with a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. 3. A patient with HIV requesting pain medication. 4. A patient with influenza receiving oxygen therapy. Answer: 2. A post-surgical patient with a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. 3. A nurse is reinforcing education about infection prevention to a group of nursing assistants. Which statement indicates a need for further teaching? 1. I will wear gloves when providing oral care to a patient. 2. I will use alcohol-based hand rub before and after patient contact. 3. I can wear the same gloves when caring for multiple patients with MRSA. 4. I will dispose of PPE before leaving an isolation room. Answer: 3. I can wear the same gloves when caring for multiple patients with MRSA. 4. A patient with an indwelling urinary catheter is at risk for a catheter-associated urinary tract infection, CAUT. Which intervention should the nurse implement to prevent this? 1. Irrigate the catheter daily with sterile water. 2. Ensure the drainage bag remains above bladder level. 3. Perform routine catheter care per hospital protocol. Change the catheter every 48 hours. Answer: 3. Perform routine catheter care per hospital protocol. 5. Which action by the nurse is appropriate when caring for a patient on droplet precautions? 1. Wearing an N95 respirator mask. 2. Keeping the door to the patient's room closed at all times. 3. Wearing a surgical mask within 3 feet of the patient. 4. Using a negative pressure room. Answer: 3. Wearing a surgical mask within 3 feet of the patient. 6. A nurse observes a colleague exiting an airborne isolation room without removing their N95 respirator. What is the most appropriate action? 1. Report the incident to the nurse manager. 2. Remind the colleague to remove the mask after exiting the room. 3. Tell the charge nurse immediately. 4. Document the event in the patient's chart. Answer: 2. Remind the colleague to remove the mask after exiting the room. 7. The nurse is preparing to perform wound care for a patient with an infected pressure ulcer. What is the most important step to prevent infection? 1. Wearing sterile gloves. 2. Performing hand hygiene before and after the procedure. 3. Using a surgical mask. 4. Cleaning the wound with normal saline. Answer: 2. Performing hand hygiene before and after the procedure. 8. Which of the following patients should the nurse isolate immediately upon arrival to the emergency department? 1. A child with fever and a rash suspected to be measles. 2. An adult with uncontrolled diabetes reporting chills. 3. A patient with a urinary tract infection requiring IV antibiotics. 4. A pregnant woman experiencing contractions. Answer: 1. A child with fever and a rash suspected to be measles. 9. A nurse is delegating a task to an unlicensed assistive personnel, UAP. Which task is appropriate to delegate? 1. Assisting a patient on contact precautions with bathing. 2. Performing sterile wound dressing changes. 3. Teaching a patient about infection prevention. 4. Evaluating a patient's response to antibiotic therapy. Answer: 1. Assisting a patient on contact precautions with bathing. 10. A nurse is caring for a patient with tuberculosis. Which of the following statements indicates proper understanding of precautions? 1. I will wear a surgical mask when entering the room. 2. The patient should be placed in a positive pressure room. 3. I should wear an N95 respirator at all times when in the room. 4. A gown and gloves are required for routine care. Answer: 3. I should wear an N95 respirator at all times when in the room. 11. What is the best nursing intervention to prevent hospital-acquired pneumonia? 1. Encouraging early ambulation. 2. Administering antibiotics prophylactically. 3. Keeping the head of the bed flat. 4. Limiting oral hygiene to once per shift. Answer: 1. Encouraging early ambulation. 12. When should a nurse remove PPE after providing care for a patient in isolation? 1. Inside the patient's room before exiting. 2. Outside the patient's room, except for the respirator. 3. In the hallway outside of the isolation area. 4. Before documenting in the patient's chart. Answer: 2. Outside the patient's room, except for the respirator. 13. A nurse is performing a sterile dressing change. What action breaks sterility? 1. Keeping hands above waist level. 2. Touching the outer 1-inch border of the sterile field. 3. Holding sterile objects with sterile gloves. 4. Using sterile forceps to pick up gauze. Answer: 2. Touching the outer 1-inch border of the sterile field. 14. Which intervention helps reduce the risk of ventilator-associated pneumonia, VAP? 1. Providing oral care with chlorhexidine. 2. Increasing sedation for comfort. 3. Performing nasopharyngeal suctioning every hour. 4. Keeping the patient supine at all times. Answer: 1. Providing oral care with chlorhexidine. 15. What is the first step in donning personal protective equipment, PPE? 1. Putting on gloves. 2. Wearing a gown. 3. Securing the mask. 4. Performing hand hygiene. Answer: 4. Performing hand hygiene. 16. Which patient requires contact precautions? 1. A patient with chickenpox. 2. A patient with a draining wound infected with MRSA. 3. A patient with pertussis. 4th, a patient with tuberculosis. Answer: 2. A patient with a draining wound infected with MRSA. 17. What is the most effective way to prevent the spread of infection in healthcare settings? 1. Wearing gloves for all patient interactions. 2. Performing hand hygiene regularly. 3. Disinfecting all surfaces daily. 4. Using airborne precautions for all patients. Answer: 2. Performing hand hygiene regularly. 18. A nurse is providing education to a patient with a new diagnosis of tuberculosis. Which statement indicates the need for further teaching? 1. I will need to wear a surgical mask in public places. 2nd, I need to take my medication as prescribed to prevent spreading the infection. 3rd, my family should be tested for tuberculosis. 4th, I can stop taking my medications once I feel better. Answer: 4. I can stop taking my medications once I feel better. 19. A nurse is caring for a patient with varicella, chickenpox. Which precautions are required? 1. Contact and airborne precautions. 2. Standard precautions only. 3. Droplet precautions only. 4. Airborne and droplet precautions. Answer: 1. Contact and airborne precautions. 20. Which patient should the nurse assess first in a medical surgical unit? 1. A post-operative patient with a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. 2. A patient receiving IV antibiotics with swelling at the IV site. 3. A patient with a productive cough who is on airborne precautions. 4. A patient with a central line who is confused and has a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. Answer: 4. A patient with a central line who is confused and has a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. 21. What action by the nurse demonstrates proper disposal of biohazardous waste? 1. Disposing of used syringes in a red biohazard bag. 2nd, placing blood-soiled gauze in a regular trash can. 3. disposing of gloves used for patient care in a red biohazard bag. Fourth, placing a soiled dressing with blood in a biohazard bag. Answer: 4. Placing a soiled dressing with blood in a biohazard bag. 22nd, a patient in a long-term care facility has a methicillin-resistant Staphylococcus aureus (MRSA) infection. What is the most appropriate action by the nurse? 1. Assign the patient to a private room. 2. Wear an N95 mask when providing care. 3. Use droplet precautions. 4. Disinfect equipment before taking it out of the room. Answer: 4. Disinfect equipment before taking it out of the room. 23rd, a nurse is caring for a patient with bacterial meningitis. Which type of isolation is required? 1. Contact precautions. 2. Airborne precautions. 3rd, standard precautions. 4. Droplet precautions. Answer: 4. Droplet precautions. 24. The nurse is educating nursing students about infection control. Which statement requires further clarification? 1. Hand hygiene is the most effective way to prevent infections. 2nd, a patient with C. diff should be placed on airborne precautions. 3rd, personal protective equipment, PPE, should be used based on exposure risk. 4th, a surgical mask is required for droplet precautions. Answer: 2. A patient with C. diff should be placed on airborne precautions. 25. A nurse is preparing to assist with a sterile procedure. Which action would break sterility? 1. Keeping the hands above the waist. 2. Turning away from the sterile field. 3. Using sterile gloves to handle sterile instruments. 4. Opening the sterile pack with the flaps moving away first. Answer: 2. Turning away from the sterile field. 26. A nurse is performing suctioning on a patient with pneumonia. What is the priority infection control measure? 1. Wearing sterile gloves. 2. Performing hand hygiene before and after suctioning. 3. Keeping the suction catheter in a sterile wrapper when not in use. 4. Wearing an N95 respirator. Answer: 2. Performing hand hygiene before and after suctioning. 27. What should the nurse do first if an accidental needle stick injury occurs? 1. Notify the infection control department. 2. Wash the site with soap and water. 3. Report the incident to the nurse manager. 4th, request post-exposure prophylaxis. Answer: 2. Wash the site with soap and water. 28th, a nurse is reviewing infection prevention measures for a patient with a peripherally inserted central catheter, PICC. Which action is correct? 1. Change the dressing weekly or as needed. 2. Use sterile gloves when administering medications through the PICC. 3. Flush the PICC line with saline every 12 hours. 4. Use alcohol-based hand sanitizer before touching the PICC line. Answer: 2. Use sterile gloves when administering medications through the PICC. 29. Which infection control measure is required for a patient with disseminated herpes zoster, shingles? 1. Contact precautions only. 2. Droplet precautions only. 3. Airborne and contact precautions. 4. Standard precautions only. Answer: 3. Airborne and contact precautions. 30. A nurse is teaching a patient about preventing surgical site infections, SSI, after discharge. Which statement indicates understanding? 1. I will remove my wound dressing daily and leave it open to air. 2nd, I will wash my hands before and after touching my surgical wound. 3rd, I will take antibiotics only if I notice signs of infection. 4th, I do not need to notify my doctor if I have drainage from the incision. Answer: 2. I will wash my hands before and after touching my surgical wound. 31. A nurse is assisting with a lumbar puncture. Which infection control measure is most important? 1. Wearing a surgical mask. 2. Performing hand hygiene after the procedure. 3. Maintaining a sterile field. 4. Using droplet precautions. Answer: 3. Maintaining a sterile field. 32nd, a patient receiving chemotherapy is at risk for neutropenia. What is the best infection prevention strategy? 1. Placing the patient in a negative pressure room. 2. Allowing fresh flowers in the room for comfort. 3. Encouraging frequent hand hygiene. 4. Using droplet precautions. Answer. 3. Encouraging frequent hand hygiene. 33rd. A nurse is explaining standard precautions to a new staff member. Which statement is correct? 1. Standard precautions apply only to blood exposure. 2nd. Gloves must be worn for every patient interaction. 3rd. Standard precautions are used with all patients regardless of diagnosis. 4. A gown must be worn for all patient care activities. Answer. 3. Standard precautions are used with all patients regardless of diagnosis. 34. What is the best action to prevent the spread of infection when removing personal protective equipment, PPE? 1. Remove gloves first. 2. Remove the mask first. 3. Remove the gown first. 4. Remove the face shield last. Answer. 1. Remove gloves first. 35. A nurse is caring for a patient with suspected sepsis. What is the priority nursing intervention? 1. Administering broad-spectrum antibiotics as prescribed. 2. Placing the patient on contact precautions. 3. Encouraging oral fluids. 4. Delaying cultures until fever subsides. Answer. 1. Administering broad-spectrum antibiotics as prescribed. 36. A nurse is caring for a patient with influenza. Which isolation precaution is appropriate? 1. Airborne precautions. 2. Droplet precautions. 3. Contact precautions. 4. Standard precautions. Answer. 2. Droplet precautions. 37th. A nurse is preparing to perform a sterile procedure. What action would break the sterile field? 1. Keeping the sterile field at waist level. 2. Turning away from the sterile field. 3. Wearing gloves while working within the sterile field. 4. Keeping sterile instruments on the edge of the sterile field. Answer. 2. Turning away from the sterile field. 38th. Which infection control measure is most effective in preventing the spread of infections in a hospital? 1. Wearing gloves with all patient interactions. 2. Keeping patient rooms closed at all times. 3. Performing proper hand hygiene. 4. Using antibiotics routinely for all patients. Answer. 3. Performing proper hand hygiene. 39th. A patient with C. difficile is placed on contact precautions. Which action by the nurse would be inappropriate? 1. Wearing gloves while entering the patient's room. 2. Using alcohol-based hand sanitizer after patient contact. 3. Wearing a gown when caring for the patient. 4. Cleaning shared equipment with hospital-approved disinfectant. Answer. 2. Using alcohol-based hand sanitizer after patient contact. 40. Which of the following practices is most appropriate to reduce the risk of catheter-associated urinary tract infections? CAUTIs. 1. Change the catheter every 24 hours. 2. Perform sterile technique during catheter insertion. 3. Keep the catheter bag above the level of the bladder. 4. Routinely irrigate the catheter with saline. Answer. 2. Perform sterile technique during catheter insertion. 41. What should the nurse do first if a patient in isolation is becoming anxious and requesting visitors? 1. Allow the visitors but ask them to wear masks. 2. Offer comfort measures to the patient and explain the isolation rules. 3. Encourage the patient to wait until the isolation period is over. 4. Immediately call security to restrict visitors. Answer. 2. Offer comfort measures to the patient and explain the isolation rules. 42nd. A nurse is educating a patient on infection control measures to reduce the risk of hospital-acquired infections, HAIs. Which statement is correct? 1. Antibiotics will prevent any infections while you're here. 2nd, hand hygiene is the most effective way to prevent infection. 3. You should avoid drinking fluids while hospitalized. 4. Wearing a mask will protect you from infections in the hospital. Answer: 2. Hand hygiene is the most effective way to prevent infection. 43. A nurse is preparing to administer medications through a central venous catheter, CVC. What is the most important infection control practice? 1. Wearing sterile gloves during the procedure. 2. Disinfecting the CVC port with alcohol before use. 3. Changing the catheter every 48 hours. 4. Wearing a gown and mask while administering the medication. Answer: 2. Disinfecting the CVC port with alcohol before use. 44. What is the primary nursing intervention for a patient diagnosed with methicillin-resistant Staphylococcus aureus, MRSA? 1. Placing the patient in a positive pressure room. 2. Administering antibiotics to prevent systemic infection. 3. Initiating contact precautions. 4. Giving the patient a high-protein diet. Answer: 3. Initiating contact precautions. 45. A nurse is caring for a patient with pneumonia. Which of the following strategies will help reduce the risk of ventilator-associated pneumonia? VAP. 1. Keep the head of the bed elevated 30 to 45 degrees. 2. Administering prophylactic antibiotics. 3. Limiting suctioning of the endotracheal tube. 4. Providing oral care with chlorhexidine. Answer: 1. Keep the head of the bed elevated 30 to 45 degrees. 46. Which infection control measure is appropriate for a patient with Clostridium difficile? First, place the patient on droplet precautions. 2. Use alcohol-based hand rub for hand hygiene. 3. Use contact precautions. 4. Isolate the patient in a private room with positive airflow. Answer: 3. Use contact precautions. 47. A nurse is caring for a patient with suspected active tuberculosis, TB. Which action is essential for protecting other patients and healthcare workers? 1. Placing the patient in a room with negative pressure. 2. Wearing a surgical mask when entering the patient's room. 3. Ensuring the patient wears a surgical mask during transport. 4. Administering antibiotics as soon as the diagnosis is confirmed. Answer: 1. Placing the patient in a room with negative pressure. 48. A patient with a urinary catheter has developed a catheter-associated urinary tract infection, CAUTI. What is the nurse's priority intervention? 1. Replace the catheter using sterile technique. 2. Administer IV antibiotics as prescribed. 3. Increase the patient's fluid intake. Apply a bladder scanner to check for urinary retention. Answer: 1. Replace the catheter using sterile technique. 49th. A nurse is caring for a patient with a draining wound infected with a multi-drug-resistant organism. Which precaution should the nurse implement? 1. Droplet precautions. 2. Airborne precautions. 3. Contact precautions. 4. Standard precautions. Answer: 3. Contact precautions. 50. Which action by the nurse would best prevent the spread of MRSA in a healthcare setting? 1. Always using alcohol-based hand rubs. 2. Using gloves when touching the patient's linens. 3. Implementing isolation precautions for all patients with MRSA. 4. Ensuring the patient is placed in a private room. Answer: 2. Using gloves when touching the patient's linens.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.